You go to the orthopedic doctor because, well, your knee has been aching every single time you walk down the stairs. They take an x-ray, pop it up on that glowing screen, point to this tiny, narrow gap, and deliver the devastating news. You're bone on bone. Oof. Welcome to Vital Elixir, your trusted resource for aging with strength, mobility, and confidence. Today's explainer unpacks this frankly fear-inducing bone-on-bone diagnosis. We're going to look at why your x-ray might not be telling the whole story and give you 4 safe, science-packed action steps to help support your knees. Now, really quick, please remember this explainer is strictly for educational purposes, so always check in with your doctor before starting any new health or exercise routine. Hearing those exact words can feel completely crushing, right? I mean, it's so easy to feel like your body is just a car with worn-out brake pads, and the only solution is to just stop driving it altogether. You stop your daily walks, you avoid getting down in the garden, and suddenly you're treating your knee like it's a fragile antique teacup. But what if I told you that modern biomechanics and rheumatology have completely flipped the script on how we view the knee joint? It's true. Premature surgery, fueled by fear, can often be totally avoided when we actually understand how our joints work. Let's replace that fear with some empowering, truthful science. Okay, get this. In the landmark Framingham osteoarthritis study, researchers took x-rays of thousands of older adults and compared those images to their actual daily pain levels, and the results were honestly staggering. Many people who had perfect, thick cartilage were in agonizing pain, while plenty of folks walking around with severe bone-on-bone x-rays had absolutely zero pain. Zero. You might be wondering, how is that even possible? Well, it's because cartilage actually has no nerve supply. It literally cannot feel pain. The pain you're feeling is actually coming from the surrounding tissues, things like an inflamed synovial lining, microscopic bone marrow lesions from poor shock absorption, or the highly nerve-rich Hoffa's fat pad that sits just below your kneecap. Your cartilage is what scientists call avascular. That's just a fancy way of saying it lacks a direct blood supply. Because of this, it relies entirely on a process called cyclic loading to survive. I want you to think of your cartilage like a dense, wet sponge. When you take a step down, the sponge compresses and squeezes out waste. Then, when you lift your foot, it expands back out and sucks in fresh, nutrient-rich synovial fluid. So if you stop moving because you're terrified of wearing out your joint, well, that sponge just dries out, starves, and starts to degrade. So the absolutely crucial takeaway here is this. Your knee is not a worn-out brake pad that just irreversibly grinds away from friction. No way. It's a resilient, living sponge. It is an adapting tissue that quite literally requires movement to feed it. You've probably heard the old saying, motion is lotion, right? Well, when it comes to your cartilage, that is the literal physiological truth. Before we get to the fixes, we have to bust 3 massive myths that keep older adults unnecessarily stuck on the couch. Myth number 1 says that walking and running destroy knees. Actually, scratch that. A massive meta-analysis showed recreational runners have lower rates of knee osteoarthritis than sedentary people. Sitting knees are more dangerous for your joints. Myth number 2 is that you should avoid bending. But listen, the deepest parts of your joint only get fed when the knee is bent under load. Avoiding bending just starves that specific cartilage. And myth number 3, the knee is the main problem. Honestly, the knee is basically just a simple hinge. It's rarely the culprit, it's usually just the victim, caught in the crossfire between stiff ankles and weak hips. Our first fix is what we call the kinetic chain rescue. We've got to treat the neighbors. If your ankle lacks dorsiflexion, which is just the ability to bend your foot up towards your shin, your knee is forced to cave inward to compensate. And if your side hip muscle, the gluteus medius, is weak, your thigh bone rotates internally, which just grinds the kneecap. The safe fix here? Mobilize that ankle with gentle wall drills and strengthen those glutes with some lateral band walks and clamshells. When your glutes are firing properly, they pull the leg into perfect alignment, instantly taking that awful grinding pressure off the knee. Fix number 2 safely feeds the sponge through low-impact cyclic loading. And the absolute safest way to do this is on a stationary bike. Now, the key here is the setup. Set the seat high enough so your leg is almost straight at the bottom of the pedal stroke. This prevents any excessive crushing pressure behind the kneecap. Then set the resistance very, very light and just pedal for 15 to 20 minutes, maybe 3 to 4 times a week. This creates thousands of gentle squeeze and release cycles, pumping all those good nutrients right into the cartilage without the heavy impact of your full body weight. Fix number 3 targets your body's built-in shock absorbers, your quadriceps. Strong quads act like muscular brakes to take the impact off the joint. But traditional squats might really irritate a painful knee. Enter isometric loading. Loop a heavy resistance band around a sturdy pole and right behind your knees. Lean back, Drop into a shallow 45 to 60 degree partial squat and just hold it right there for 30 to 45 seconds. Rest for 2 minutes and repeat that 4 times. This safely fires your quads at maximum capacity without sliding the joint surfaces together. Plus, some research suggests heavy isometrics can act as a profound natural painkiller for joint pain. It's a total game changer. Remember earlier when we talked about how the pain comes from the inflamed synovial lining? Systemic inflammation makes the joint environment toxic and hypersensitizes your pain receptors, but we can lower this chemical noise safely. First, you might consider third-party tested omega-3 fatty acids. Roughly 2,000 milligrams of combined EPA and DHA daily may help support joint health by cooling down inflammation. Second, support healthy blood sugar with protein-forward meals followed by a nice 10-minute walk. This helps prevent the buildup of byproducts that can literally stiffen the collagen in your knees. Finally, for immediate pain, ask your doctor about topical NSAIDs like diclofenac gel. Unlike harsh oral painkillers that can really upset your stomach or cause other issues, topicals penetrate directly into the joint for targeted relief. As always, please consult your healthcare provider before making any significant changes to your health, supplements, or exercise routine. But I want you to remember this: you are not a worn-out tire. Do not let a single, two-dimensional X-ray dictate your future or strip you of your independence. Mobilize your ankles, strengthen your glutes, pedal that bike to feed the cartilage sponge, load your quads isometrically, and take steps to calm systemic inflammation. Your knee has carried you your entire life. It is incredibly resilient, and with the right science-backed care, it can adapt, it can be supported, and it can keep you moving gracefully for decades to come. So, I want to hear from you. Are you going to let a piece of film dictate your independence, or are you going to start safely feeding your joints today? Let me know in the comments. Which of these 4 safe fixes will you start first? You absolutely have the power to age with strength and confidence. Keep feeding that cartilage, keep living your best, most active life, and I'll see you in the next explainer.
Thank you for your time. Subscribe for more health education. Like the video and share it to help others stay informed.